So just kind of giving some 101 on this. Plantar fasciitis starts in the bottom of the heel, the inside aspect of the heel. So you can check my previous videos on that. I'm not going to put my foot on the camera right now, but you can check out other aspects of the Fortress Instagram story. But the inside portion of the heel tends to be a pretty tender spot for the development and the origin of plantar fasciitis. However, we don't know how exactly we develop this plantar fasciitis. So what is it? As a clinician and other research that is out there, there has been some claims that it is a what we call inflammatory issue or concern, but now we're leaning more towards a breakdown of the tissue starting at that heel. Again, you can reference these photos on the Facebook page and the Instagram page of the previous couple posts that I posted recently. So this degeneration of the tissue occurs over time. So sometimes when we keep doing the same thing over and over and over, and then increasing more volume or load to that specific portion of the body too fast, too soon, and consistently doing that, we put too much stress on that piece of tissue, whether it is the plantar fascia or other tendons, i.e. the Achilles tendon. That portion of the tissue, particularly when we are talking on the bottom of the foot, does not become resistant to that constant overload. So in turn, that tissue starts to break down, and then you start developing pain. So essentially, pain is kind of good. It helps us determine if something is alarming or not to the body. So it's kind of like a defense mechanism. But sometimes this pain in the bottom of the foot can be cumbersome. So some patients and people may experience pain from that heel aspect into the toes, especially your big toe and perhaps the second toe, and that inner portion of the arch of the foot. So when pain is developed there, we tend to develop pain with walking, pain with stairs, pain with stooping, squatting, right? Your normal daily routine. So again, normal daily routine activity in turn becomes cumbersome because that tissue starts to break down or not be able to withstand normal daily forces throughout, because either maybe you trained your or you changed your training routine a little bit different. So if you're an avid runner, runners, if they're prepping for a marathon or a half marathon, they have to increase their mileage during a certain period for a certain time, i.e. weeks to months. Sometimes they might do that too fast. And if you increase, for example, if you're going to run 5 miles today, tomorrow is 30 miles. And then you keep like repeating that, and then eventually it's like 20 miles, 20 miles, 20 miles, 20 miles each day. That tissue is going to start to break down. So in turn, pain starts developing into a piece of tissue that was all nice and healthy and able to withstand normal forces, normal torque, appropriate training volume applied to that piece of tissue, and it just doesn't like it anymore. So then your nervous system and your pain signals start going off. So then you develop pain into the arch of that foot, perhaps maybe into the calf muscle, and then you kind of try to find some home remedies. Maybe you rub your foot on the bottom of rub the bottom of your foot on a tennis ball. Maybe you ice it. Maybe you put some icy hot on it. But in turn, you're essentially not doing anything for that piece of tissue. Probably one of the biggest things with plantar fasciitis is since it appears that it is associated with too much forces, too much fast progression of those forces, most likely there was a change in your training volume or activity level. So nurses are a perfect example. We know that nurses stand on their feet primarily multiple hours throughout the day, or surgeons, right? So being on your feet and not being used to that on that amount of time of being on your feet can cause some cumbersome and unwanted forces into that tissue on the bottom of the foot. So essentially, no matter if you are a nurse and you're walking around a lot and you're on your feet and you're tending to your patients versus someone who is an avid runner training for a marathon or a half marathon, I always like to say and kind of portray that the poison is in the dosage, right? So if you do too much too fast in a short time frame, you're kind of setting yourself up for failure. So one of the number one things with plantar fasciitis that I highly advise is you have to do a gut check on your training volume. So when I have a patient that comes into the clinic, and one in particular does come into mind, he is a pretty avid runner. He's probably 50 and had a history of heel pain. So, I told him, I was like, you need to decrease your training volume on your feet when you're running, and perhaps maybe revert to an alternative aspect of getting cardiovascular fitness. So swimming, biking, or you're on a recumbent bike or cycling, right? Because the foot is a weight-bearing joint. So if you keep pounding and pounding and pounding and pounding it and not giving that tissue rest, you're going to keep snowballing things. So probably the number one thing for plantar fasciitis that you can do for yourself is assess your training volume or your activity level pertaining to your job. Are you spending more time on your feet? Are you walking a lot more? You kind of need to do a self-assessment. Probably the second thing that comes into mind that you can try to attempt to remedy at home is your shoe. What type of shoe do you wear? And I posted this on a previous video, but super important. I will tell you right now, I have shoes from college, and I'm kind of like a shoe neat freak. I have shoes from college that don't have a lot of miles on them, but I like to keep my sneakers all nice and clean. So, and I'm by all means not an avid runner at all. Like, I don't like running at all, although I did run about 1.5 miles today. So checking the history of how many miles you have on that specific shoe that you wear all the time, right? No matter if it's walking and accumulating that walking of that shoe wear over time. Oh, Hoka, yeah. I heard a lot about those shoes. Oh, Jillio is checking in. Hang on, let me get Jill in here. All right, Jill, there should be a prompt on your screen. Yeah. Oh.
Hey, friends.
Hey. What's up?
All
right, Jill is here. Dr. Jill.
Hey.
All right. So, everybody, this is... Yeah. There you go. It keeps cutting out a little bit.
It's cutting out a lot. Yeah.
So this is Dr. Jill, my colleague. Her and I used to work together way back. Gonna try to revive that here. So, but she's here to join me to talk a little bit more about plantar fasciitis. So, Jill, when you bopped in, maybe you can definitely hone in on this since you're an avid runner and have trained for half marathons.
Yeah.
So I was talking about some remedies at home, people, maybe perhaps checking the how many mileage they have on their specific shoe that they use.
Yes.
What are your thoughts on that?
I mean,
Like,
I
what are
definitely
some
agree
things
on
that?
that. I know there's a couple different apps out there too that people can use to track their running. And each time you go for a run, it will add mileage to a specific shoe that you run in that day. So I like that because it kind of keeps track of how many miles are on that shoe. And then, change them out. I mean, sometimes they'll say a certain amount of mileage on a shoe, but if you can look at the bottom of your shoe and it's looking like the tread's going, I mean, it's probably going to be time to replace that shoe where it's breaking down inside too. So, but I like using those apps because I can't keep track of it. So I let that do the work for me.
Oh, I didn't even know. I wasn't even aware of any apps that do that. So what app do you specifically use?
So I use the not Map My Run, the Under Armour one for running. Let me think. Let me see what it's
Oh,
called. Um,
cool.
Runtastic
So,
is the one that I use.
okay.
Yeah,
So fantastic. Cool. I did not know that. So hence I'm not a runner.
Runtastic. Yeah.
If you aren't sure of mileage, is there a time frame that perhaps is recommended to change out shoes? Perhaps 6 months. Bonnie asked that question. What have you personally done, Jill?
I probably do 1 to 2 big races a year. So if I do like a marathon, I might have another half later that year. And I will probably switch out. Let's see, if I train for the marathon and get maybe halfway through training for a half, then I'll switch out for sure. Especially doing a marathon, you're putting a lot of miles on each week. So, but I would say definitely look at the shoe. Like if you start looking and you can see the tread starting to wear, it's starting to get fuzzy kind of around it instead of that nice crisp feel on the bottom of that shoe, chances are that arch is starting to break down.
Yeah, yeah.
Mhm.
Cool. Awesome. So Bonnie, I
Yeah.
think probably if you run all the time, I would say a good maybe somewhere 3 to 6 months. Looking at that, and again, like Jill said, checking the bottom of that shoe. Cool. Um,
Yeah.
I guess jumping ship. So definitely the number one thing is your training volume or how much time you stand on your feet, the type of shoe that you wear. Because I know that, and
Hmm.
I've heard, I listened to a pretty cool podcast this week regarding plantar fasciitis and uh, the type of shoe. Wearing steel-toed boots can promote perhaps an environment for plantar fasciitis development,
Hmm.
right? So people who have to wear hard hats and steel-toed boots at work probably are a little bit more prone to developing plantar fasciitis rather than uh, um, maybe a CrossFitter or something of that nature.
Hmm.
Um, so regarding some other research, I know and personally have gone through some my fellowship training. So we just put out about 2 years ago an article on electrodry needling into the plantar fascia of the foot and got significant results. Um, so I've done that on multiple people, and
That's
I
cool.
have probably about 3 patients right now that I do that on, and two of them I've had literally a significant change in the first visit. So have you done any plantar fasciitis dry needling as well? Jill is dry needle certified, like myself, but she's trained a little bit differently. Um,
Yeah, I
have you?
I have not actually had a client since taking the class that has had the plantar heel pain. Um, I will say, like the old method that I did years ago was definitely a lot of that soft tissue work, And that's kind of proven to be maybe not the best thing to be doing anymore. So it's kind of cool to see the new research and how we've got to change with the time. We've got to change with the times and what's showing to be effective. But yeah, that was a lot of what we were doing before was kind of that digging in there, breaking up things with an assist,
Yeah.
Yeah, we did a ton of that. So I mean, it is cool to see the new what's coming out and saying that that's not effective. Let's work on these low loads, slowly building up the load on the tendon. Yeah, but I have
Right.
not done the
For
needling.
sure.
I'd love to.
And
I'd love to try that.
anybody have plantar fasciitis out there? Go see Jill.
Right.
Um,
Yeah. Let me check it out.
yes, and yeah. So one of my patients, she's on right now. I can't. I don't. I
Cool.
think I might have dry needled her twice, but we had some other things to tend to at the moment. But yeah, Maria said that she had some relief immediately. It's not
Yeah.
comfortable, but that get down to the source of the pain, right? Me
Hmm.
rubbing that piece of tissue with my hand, hoping that I can touch, the deep insertion onto the heel. That's not going to do
Right.
anything.
Right.
So that's
And just
one
talking about
seeing a physical
how
therapist.
much, go for it.
Oh,
Just talking about how
seeing
much
a physical
force is
therapist and
needed.
don't let things ball up and snowball,
Right.
right? Because it the timeline for plantar fasciitis to rebound and get back to, it can take up to a year or longer. So sometimes when patients are in it to win it, and it's hard because we have to educate them a lot, right? Like, this is going to
Hmm.
take time. It is up to you. You are here to see me for 1 hour, and then you have 7 other days during the week,
Yeah.
minus 23 hours to do what you need to do. Like, so it's being smart with those progressions of loading the tissue, while still, maintaining your cardiovascular fitness, i.e., swimming,
Hmm.
biking, um, weightlifting, all that. So,
Hmm.
for sure, for sure. Have Jill, have you personally experienced any plantar fasciitis since you are an avid runner?
I thankfully have not. Um, I do change my shoes quite regularly. And I will be honest, whenever I start training for a race, part of the nerd in me is to get my training plan completely like scheduled out to where I'm doing, 4 runs a week. And I start super low mileage because I know that physically, I just can't take that much. So I have done one race where we started training a little bit too heavy, and I'll be honest, that race I was slower than I'd ever been in any of my other races. So I really think that prevention is huge, really taking the time to plan that out. Now, as an athlete, we can kind of tailor that a little bit. If you're talking nurses or someone on a construction site or something like that, they get a new job and they're jumping into these boots that they've never worn and they've got a 12-hour day. I mean, that's a little bit harder to adjust. But I definitely think if you can be preventative, if you can start small, if you can buy those shoes and wear them for 2 hours one day, 3 hours the next day, 4 hours the next day, and get used to it, I think that's a big thing right now, is just to prevent that, because like you said, that injury does take a long time to heal. It takes a long time. So we're on our feet all day.
Yes, yes, for sure. And I'm glad you touched on that. So, not only getting a new pair of shoes, right? Because when you
Mm-hmm.
do get a new pair of shoes for running, I'm not just going to go run 30 miles in them immediately. It's
Right.
just like getting a new pair of eyeglasses. You got to build your time and your hour and your wear in that. And slowly that tissue starts adapting well, appropriately over time. So, I guess I would be interested too, and maybe for other people, Jill, can you give an example of maybe when you were training like a month or two out from your half, and then how you like, were you like, okay, 10 miles on Monday, Tuesday was 15, and then we kind of, hit 11 miles. Can you just give like a little example timeline on that, on how you progressed your load and then tapered?
Yeah, I will tell you. So I am a big fan of the Hal Higdon training programs for running. He's got tons out there for novice runners, advanced runners, and he kind of, I mean, some you can find them online. I don't think you have to purchase them, but you can find them. And so basically what you do is you're adding a mile to your long run every week. So you're going to have 3 days where you might be running, like one day it's a 3 mile run, the next day is a 4 mile, you have a break, then you run another 3 mile maybe for speed or pace. And then your Saturday, or I always do Saturday run. A lot of times it's a Sunday run. You kind of want to match it up with the day your race is going to be. It is the day you train your long run. But then you go up 1 mile each week on that. Now, sometimes you will regress. So, like that first week, maybe my long run is only 4 or 5 miles. And that's a good place to start. So, you do a 3-4-3 and then like a 5 mile run on the Saturday. And then the next week, still a 3-4-3 and then a 6 mile run. And then a 3-4-3 and a 7 mile run. And then you might change it up. They usually will go to like a 3-5-3 and then go back to a 6 mile run. So you kind of decrease by a mile on that long run. For those, it's not actually an app. You can just look up the, on, I think even on like runners.com, you can look up Hal Higdon. I think you can look them up on Pinterest too, Hal Higdon running programs, and find one that kind of suits you.
What?
Hal Higdon, I don't know if I could type it in.
HA?
HAL, and
Yeah,
then I
see
think
if
it's
you can type it. How,
Hal Higdon.
hang on, Maria, we're
That should
getting
be
that right
it.
now.
Um,
Higdon.
I
There
believe
it
that's how
is.
you spell
Okay,
it. Yeah. So,
Jill
and yeah, if
just
you
typed
look
it in.
up those training programs, they usually progress you pretty well. And like obviously the more beginner the program, the longer it will take you to progress up to those miles that you're going to
Yeah,
run. So
that's super cool. And you could probably kind of adapt that with like your cardiovascular fitness too, and then using the rating of perceived exertion scale.
hmm
And you could probably still correlate that with your run and then tailor that.
yeah. And I usually take one that I feel like is doable for me, and then I tailor it to myself anyway. So, they might have you do, just depending on days of the week, you got to work, especially if you're training for a long distance race, you've got to make it work with your schedule. So if you're working 5 days a week and you've got, 7 a.m. start days, I mean, it's going to be tough to run those mornings. Just depends on when you're going to be doing it. So,
Yeah.
and like I've got a Wednesday meeting every morning, so that is not a good running day for me. So I have to do like a Monday, Tuesday, Thursday, Saturday. So I mean, you're going to kind of tailor it. I always pull it up on like a grid on the computer, and I kind of make my own a little bit, but going based off of how he progresses his weeks.
Yeah, that's super cool. Awesome. So,
Yeah.
Hal Higdon training app for running specifically. Yeah, I
Yeah,
like that
it's not an
approach.
app. It's
And
just you can just look up his guides.
yeah, like a little training packet or something of some sort, or a
Hmm.
PDF maybe he'll have out or something, like a little calendar. That's
Yeah.
awesome. Cool. So, um, you know, and just to touch on too, like to spin off what you said, Jill, like getting your volume appropriately set up, like you said, like if you're competing on a Saturday, then you have to mimic that on a Saturday. That's kind of just
Yeah.
like I did when I just went to Miami. I had
Hmm.
to slowly increase my volume and then vary my intensities throughout the day so I wouldn't come home with aches and pains. And this not only goes for plantar
Right.
fasciitis, this is just in general too. Um,
Right.
so that's definitely a great info there for sure. So um, so being able to have a schedule and a legit calendar set up, and when and if you come in to see your physical therapist, will most likely kind of give you some small mini exercises to work on, especially the
Hmm.
hips, right? Because when you run, the hips have to be strong to be able to appropriately transfer the forces into the knee, which then transfers the forces into the foot.
Yeah.
Um, those are some things that we can do, as well as even assess the running. Um, I'm not a guru on running assessment, but like I know basics. So
Hmm.
that's another thing that a physical therapist can do and help with. Um, in order to get a patient over the hump and help abolish this plantar fasciitis development from getting worse.
Hmm.
Um, cool. I mean, we're like 30 minutes in, so, but
Yeah. We said 30 minutes, right?
uh,
Any,
I think that's probably some of the basics. I did put out
yeah.
a video earlier today. Next week, I'll be putting out some little tidbit exercises that I typically would give a patient with plantar fasciitis.
Hmm.
So be on the lookout for that next week. Um, Trying to think of anything else. Does anybody else have questions? I know there's probably only a couple people that are on right now, but um, yeah, we had a question from Bonnie. That's cool. Um, yeah, so any other input, Jill, regarding plantar fasciitis?
I think if you have it, the sooner you can start treating it, the better it's going to be for you, especially knowing that it is a long process to recover from. And being athletes, we don't want to be down for long. So definitely get in if you're having any
Right.
heel pain, foot pain. I mean, I know a lot of runners, knee pain. We're not talking about that right now, but if we got some runners in the group, knees are usually a big, source of pain. So, but definitely, before you get too far into that training, you want to make sure you're doing things right. So,
Right. We want to be ahead of the snowball rather than catching up and trying to make the snowball smaller. So, and that goes for anything, but
hmm.
plantar fasciitis, that's not fun because we're on our feet all day. So, so
Hmm.
yeah, um, I think that's probably it at the moment. But if anybody else has any
Awesome.
questions, send Jill or I a DM. Um, you guys can see Jill how her Jill Glenann is her Instagram name, JILLGLENANN, and you can see that she's logged on there. And I'll send a
Yep.
follow up post as well. But definitely reach out to Jill or I if you guys need help, and we're here to help you. Um, so needling helps, yeah. Needling. I will say, needling. It probably takes a consistency with that. I would probably needle the patient, if they can, once a week in order to help stimulate a good uh, kind of like inflammatory process, because inflammation's good to a point. But when we get in this kind of bad inflammation where it just won't do what it needs to do, the needle, the dry needling can help stimulate a better response. So
Mm-hmm.
the DL, Dr. Amy does DL. Yeah, she meant to say DN, dry needling.
Yeah.
So,
The end.
so yeah, the research on that is pretty solid, and it's not comfortable. I will say on the heel, it's not comfortable at all. But when you're in pain, you'll find something in order to get out of that. And research shows that dry needling is a great adjunct, along with stretching and being proactive and being active with exercise and paying attention to the small things.
Mm-hmm.
So yeah, definitely. So if you guys have any other questions, send Jill or I a direct message or a message on Facebook or even on Instagram, and we'll get back at you guys. Topic of the month next month, I'll be putting out. I think we're going to talk about a little bit of Achilles tendonitis. So it kind of spins off from plantar fasciitis, but we'll talk about a little bit of Achilles tendonitis on that next month, and then just kind of go from there. But thank you for everybody for joining in, and thanks to Jill for being a runner as well.
Yeah. Of course.
Awesome. Cool. All right. Well, thank you guys very much, and then we'll talk soon and keep everybody updated with everything. And I would like to see some more garage gym or home workouts posted as well. And you guys can totally post or tag Fortress in it if you want.
Yeah. Good to see you, Dr. Amy.
All right. You too, Dr. Jill. All right. Talk to you guys later. Thanks.